Life's transitions, whether it's midlife shifts or other significant changes, can be difficult to navigate, often bringing uncertainty, loss, and a redefinition of identity. People may experience physical transformations, emotional fluctuations, evolving relationships, career transitions, and shifts in personal aspirations. One of the most challenging aspects is that change demands adaptation. Even when we feel unprepared, letting go of a familiar version of ourselves while stepping into the unknown can be daunting and unsettling. Yet within these challenges lies immense possibility. Change invites self-reflection, reinvention, and the chance to uncover new purposes. Embracing it rather than resisting it allows us to move forward with resilience and confidence, shaping the next chapter with intention and strength. Thanks for joining us today. We are going to be talking about embracing the changes and challenges of midlife. So joining us in the studio is Kirsten Miller and Missy Mills, and they are clinicians from the Functional Health and Wellbeing Center. So welcome.
Thank you.
Yeah, this is kind of a personal journey. You both know where I'm at in this journey. We're going to be talking about that, and I feel like we're going to be talking at it from, like, we're not even going to be like hitting the top layers of this because this is just so such an immense topic. But before we get started, tell the audience a little bit about yourselves. Missy, you want to start?
Sure. I'm Missy. I'm a nurse practitioner here. I have almost 30 years of experience as being a nurse and about 8 years of experience as a nurse practitioner.
Yes.
I really enjoy working here with the Phoenix Contact staff. It's been wonderful, and I love working with Kirsten.
Good, good.
Thank you. My name's Kirsten Miller. I have been in healthcare my whole adult life, from being a nurse's aide to LPN to RN, but I've been a nurse practitioner for the past 7 years, and really enjoying working here as well.
Great. Good. Well, welcome to this conversation. So as I mentioned, this is I'm going to be sharing some of my journey, my story along the way with this, which you both have been very much so helpful with me in this process. But we're going to be talking about some of the fun words that are in life that not everybody wants to mention. That's menopause, perimenopause, hormones, and for men, andropause. Because this is a change in life that affects all of us. It's not just a female thing. It's all of us, male, female, and the age range can vary. It can be your 30s, your 40s, your 50s, and beyond. And change is inevitable, as we all know. We've all gone through different changes. So we're going to talk through some of the common fears and misconceptions about aging and understanding that, understanding that change in hormones and what that looks like and why it has to happen. You know, I think some of us, you know, myself is, you know, I've been going through life and like, this is what I'm going to do, and just, you know, going from one thing to the next, and then all of a sudden, like what happened to me 5-6 years ago, I feel like I hit a brick wall. So, and you have the experience and the medical background in working with not only our employees here, but with other patients as well. So, how do we need to start talking more about the changes in midlife and the changes of life for everyone?
Yeah, I think it helps to be open about it. I don't think it's something like traditionally our parents talked a lot about, or our grandparents. You may have just like noticed, like, oh, my mom's been more moody lately, but maybe there wasn't a conversation about what was actually happening.
Yeah.
So talking to other people that are going through something similar can be helpful.
Yeah.
And of course, talking to healthcare providers to let them know that your body's going through these changes.
Yeah.
I think the words that we choose are important as well. Midlife crisis is something that we hear a lot.
Yeah.
And it doesn't have to be a crisis. It can be like an adventure or a challenge.
Yeah. Yeah, but I think the key point, Kirsten, what you said there was, you know, growing up, the generations that came before us, it wasn't talked about. You know, it wasn't those type of things. It wasn't, you know, it was kind of almost maybe like an embarrassment. Oh, I shouldn't be talking about how I feel, or I shouldn't be talking, I shouldn't be sharing that with other people. And I think that stigma is what kind of put that midlife crisis, the word crisis, in place. And I personally would love to see that word removed, because there's a reason why all those words end in pause. It's a pause in your life, a chance to really evaluate your next chapter. Yeah. So true. I think the words that we do speak about ourselves really does play a big role in this time in our lives. We're all ladies here, and I feel like, this is, for the women, it's becoming a more open topic to talk about. But I want to talk about the men first. Let's start there, because they really deserve, a place at the table for this, because they are experiencing similar things. If they're not talking about it, that's fine. No judgment there. But let's kind of take a deep dive. So for men, it's called andropause. What does that mean?
It's the slow decline of the male hormone testosterone, which can lead to fatigue, mood swings, decreased libido, erectile dysfunction, sleep issues, muscle loss, and belly fat.
Yeah.
Fun stuff.
Yeah, kind of like the tire. I hear, I've heard men say, oh, I've got the midlife tire around the belly and that type of thing. So they're experiencing the same similar side effects to that balance change, and what's happening internally with their body, and that all plays a really important role. So talk through some of the challenges that men face as they're going through this type of shift, so to speak.
Mood changes.
Yep.
They may feel more depressed. The brain fog is a pretty big one too.
Yeah.
Again, their sexual health may decline, and that's something that can be kind of embarrassing to talk about.
Yep.
For sure. They may notice, like, if they're active guys and they're going to the gym and they do a lot of lifting, that they're not getting the same results that they used to, and that's where we see that, belly, the tire that you referred to earlier.
Yeah.
So, yeah.
Yeah, and I think too, a lot of men and women play sports, and how you eat for a sporting event is very different than how you eat for normal life. So if a man is, was a football player or played soccer or basketball or that type of thing, they use a lot of energy, and certainly how you needed to eat for that is much different than when you stop or you slow down and you stop eating. And that's really the big piece that we'll talk about in a little bit, is really tapping into your nutrition, and kind of stepping away from maybe the extra beer, the extra alcohol intake, or the extra chips and dips and things like that. But I think too, overall, talk about Missy, kind of the society perspective for men, and maybe what that plays a role in with their mental health as they're going through this transition, this shift.
I think it's hard for men because when I was younger, men didn't talk about emotions as much as we do today.
Yeah.
Mental health wasn't as mainstream as it is today. So I think it's really hard for them to reach out and ask for help. And, men don't like to look weak. So,
Yeah.
they have to maintain, they don't want people to think that something's wrong.
Yeah. Yeah. And you make a good point there, because, when we're all younger, we all tend to feel like invincible, like we can do anything, handle everything. But when your body starts to kind of send out those reminders like, hey, there's some internal changes going, and I need you to slow down a little bit, and I need you to take care of yourself a little bit more, that can be overwhelming if you're not prepared and ready for that. And for men, it can be, kind of thinking through, well, I can't do everything like I used to be able to do. And that, I think, really plays a very heavy mental effect for them. Would you agree with that?
I agree. And I think, kind of stereotypically,
Yeah.
Women tend to kind of relate to each other more, or maybe be more open about oh, this is happening, that's happening. I don't think, in general,
Yep.
sometimes men don't have that same social support.
Yep.
So.
Yeah, absolutely. When we were talking, you had mentioned, and Missy talking through some of our notes in, with men, if they feel like they're not on top of their game, so to speak. And I think years ago, the last generation, the generations that came out of World War I, World War II was just suck it up, you can handle it, or man up. We've heard those phrases before, but it doesn't have to be that way. And there's no fear in saying, you know what, I can't do the things that I used to be able to do, but you can do them differently.
Right.
Yeah, yeah. And it's really working through kind of how do you do that differently. So maybe it's not a matter of, I can go out and play a basketball game for 4 hours. Maybe it's I can only play for 2 hours, and then I have to give my body the rest that it's needed. So what's happening internally? There's a lot going on internally, not just on the physical outside, even though society tends to look at the outside of making sure that you still look fit, you still look like you're in your 20s and in your 30s, and that can be so very deceptive, especially for men.
Yeah.
So share a little bit into that piece of what is going on internally with them.
I think typically with men, there's more gradual decline of the testosterone.
Yeah.
And there's testosterone receptors throughout the body.
Okay.
We're not even sure the entire role that testosterone plays.
Okay.
And of course, women have testosterone too, so it's all about a balance. So sometimes another thing that can happen is your hormone detox pathways can be impaired by stress, poor nutrition, illness, toxins in your environment. And then instead of getting the really potent form of testosterone, the active form, you can get these kind of byproducts that aren't as effective.
Yeah.
It can just kind of spiral into all the symptoms that we see with low testosterone.
Yeah. Yeah, that plays such a huge part. It's amazing as I've been learning throughout my journey in my change of life, how much is being impacted internally with the loss of testosterone, with the loss of estrogen for women, that type of thing. And so we'll dive into that a little bit deeper. But so any advice that you would give maybe some male patients that came to you and said, hey, I'm not feeling myself, or I'm not feeling like I was in my 20s?
The cool thing is, pretty much for men and women, it's all lifestyle changes.
Yeah.
And I don't know if you want to do them all at once, but there's 6 pillars of health and wellness that we actually focus on.
Okay.
And we can include a slide.
Yeah. Do you want to kind of touch base on those a little bit?
Yeah. We need connections, which is social support with friends and family. Participate in clubs or groups, volunteer. Church can also go into that. We want to avoid toxins. That includes artificial sweeteners. Check the labels of products that you use on your skin, because there's some toxins in there. And switch to natural cleaning supplies for your home.
Okay.
Nutrition. Get 6 to 12 half-cup servings of vegetables a day. You want to get protein, fiber, healthy fats with each meal. Drink about 64 ounces of water a day.
Yeah.
If you're having lots of food with high contents of water, you might not need to drink as much water.
Like your fruits and your vegetables.
Yes.
Yeah, the watermelons and things like that.
Exactly.
Yeah, good point.
Sleep. If you can get 7 to 8 hours of sleep, turn off your screens at least an hour before going to sleep. It helps to get that blue light out of your eyes so you can rest. Sleep in a cool, dark room. Emotional health, practice mindfulness, breathing exercises, and set boundaries.
Yeah.
And then exercise, I think everyone should aim for 30 minutes of activity a day to get the heart rate up. Make it fun, or else you don't want to do it.
Yep.
And then incorporate resistance training twice a week.
Good. Yeah, those are all great points. I think the key thing for both, for anyone going through any type of change, is to seek help. And don't be embarrassed. Don't be afraid to ask questions. If it's a physician or a family friend or a pastor or somebody you trust, just reach out to them and say, I've been feeling different. Things don't feel the same for me. So I really want to encourage the men who are listening to this message. There's a great chapter of your life that's coming. It's going to look different. It is called change for a reason. It's going to look different, but if we can get that message out of, change is coming, but that's not a bad thing. You just have to learn how to shift, and sometimes it's easy to do, and sometimes it's not. But it doesn't have to control your life as it is now. So good. Anything else from the male side of things? Did I miss anything?
Yeah, so we can kind of go over the definitions. So with andropause, the main hormone affected is testosterone. With menopause, we're thinking about estrogen and progesterone.
Okay.
Andropause usually starts around 40 to 50 years old. For menopause, that typically occurs between 45 and 55 years old.
Yeah.
And like I said, typically with men, it's a gradual decline over years. Women, you're falling off a cliff, unfortunately. It's within a few months to a year that estrogen really declines. Andropause, you're still fertile. You're often still fertile. We hear about, Robert De Niro just had a baby in his 80s. But your sperm quality may decline.
Yeah.
For women, fertility ends during menopause. You're not releasing those eggs anymore. And just to kind of summarize the symptoms again, typical symptoms for andropause are low energy. That's probably the most typical one that I see when I do test testosterone in men, is just this really debilitating fatigue. Yeah. Mood changes, low libido, and muscle loss. For women, it's hot flashes, mood swings, irregular periods. The diagnosis for andropause, we can do blood tests for testosterone. Typically, we do 3 morning values.
Yeah.
And for menopause, we do menstrual history and hormone levels.
Yeah.
And for andropause, treatment options, lifestyle changes are our big go-to, for sure. We do consider testosterone therapy as needed, and same with women. There is hormone replacement therapy and also lifestyle support. Yeah. And then I don't think we had it on the slide, but for perimenopause, that can occur as early as your mid-30s, can go up into your 50s. And the big difference there, that instead of that sudden drop of estrogen, it's kind of yo-yoing and fluctuating, so that can cause just the whole spectrum of symptoms. Some mood swings, irregular periods. You may have dry skin one month, acne another month. And another big difference is you're still fertile. Potentially your fertility is decreasing, but that is kind of important to know for family planning. Even if you're in that perimenopause, you're still fertile.
Yeah. I think it's so key, as you went over that, just to reiterate, if you are in this time of your life and you noticing changes, to really get connected with a good physician, a good provider, because there is help for that. There is supplements that can be taken so that you're not feeling those effects, or they're not as great. Or, like you said, a change in how you're eating, because some of the shifting in nutritional wise can fill in the gaps for maybe some things that are now lacking, like vitamin B, or a little bit more vitamin C and D and things like that. So it's really just kind of be your own advocate. If you're not feeling the way that you would like to be feeling, then go out and talk to somebody and find out what can work for you, because life is worth it. It doesn't have to feel like it's over. In my case, the change of life hit me like a wrecking ball. Literally, I felt, so when I turned 50 a couple years ago, it was literally like that. I was going along with life, and just enjoying the ride, and then all of a sudden it just felt like life came out and whacked me across the head and said, pull over because because you're taking a break. But just to share my journey, so I went to my female gynecologist at the time, and I expressed to her, I'm not feeling like something is going on, something is happening. And then I described what was happening. Now, no judgment here, but this individual did look at me and say, you're probably experiencing menopause, perimenopause, and there's nothing that you can do, so just live with it and deal with it. And honestly, that was crushing for me. I left that appointment crying because I was like, is this the way my life is going to be? And so I wasn't satisfied with that. I connected with the Functional Health and Wellbeing Center here at Phoenix Contact. So grateful for that. And the team here said, I reached out and I said, do you know anybody I can talk to? Here's what's happening. And the team said, we can help you. And that's when I first learned that there's blood work for menopause, there's blood work for testosterone, and that's when my journey of embracing and finding out all about this really took place. So grateful again for what you bring to all of us here at Phoenix Contact, and that experience. So as you mentioned, for women, we get the two pauses thrown at us. There's a perimenopause. Again, that's kind of like the beginning phase, correct?
Correct. Yeah.
Where things can still seem kind of normal. There can still be some family planning. Things are kind of, but it's really, is it like your body slowing down?
Yeah.
A change.
The estrogen levels may decline 1 month, another month they're back up.
Yeah.
It's kind of a roller coaster.
Yeah.
You're not in menopause until you're a year without your period.
Yeah. Okay. Okay. That's good point to know. And I have heard that if your cycle starts again, it starts all over. So I've had some friends experience that, and they've like, oh no, I'm starting over again. So what's the difference? I mean, we talked through the difference of estrogen and testosterone and how they affect each of us differently. And that was another thing that I learned in the process, was that women also have some testosterone in them, and that can also affect how you feel and your energy level. So that was really kind of interesting to me to learn all of that. And the estrogen piece, I did not realize how estrogen plays a part in everything, even our brains and how we think. And so there's a word for that too. It's called brain fog. And that has been probably one of the biggest challenges for me over the last couple years as I'm going through this journey. But why is that? Why is the loss of estrogen play such a role internally?
I think it might not just be the estrogen, but the lack of progesterone that we're not producing as much in perimenopause and in menopause. So then our detox pathways get kind of backed up. And if we aren't giving our body the lifestyle support it needs, then it just can't detox the testosterone appropriately, and then we get more estrogen, so that we can get imbalanced.
Talk about some of those lifestyle changes.
Well, a huge one for sex hormones, and if you've talked to me in the office, is eat your cruciferous vegetables.
Okay.
Increase your fiber intake.
Yeah.
It's like, that's my soapbox.
Yeah, and your
Eat
vegetables,
fiber.
eat more broccoli, eat more cauliflower, cabbage,
kale, arugula, radishes.
Yeah. And if you're not a vegetable eater, then find a way to get that into maybe smoothies, but getting that into your diet is so key.
There's a supplement.
And there's a supplement. All the more reason to talk to your doctor. So, but yeah, it's really, it does affect how our internal systems are now able to process food differently. So where we once were able to maybe in our minds feel like, oh, I can eat the chips and I can eat the pretzels and I can eat the pizza and all that stuff. eventually that's going to really come back to us because it's an overload for our internal systems, correct?
I wouldn't say you can't do that ever.
Okay.
But we have to find a balance.
Okay.
80% of the time we're doing the right thing, and
Yeah.
20% of the time we're human.
Yeah, good point. Yeah, but I think that's a good point to bring up because you're going to need a lot of grace during this time of really getting, working things out until you figure out what works for you. Yeah. So, if you have that cup of coffee in the morning, or got caught the other day, or if you have that bag of chips, don't give up. Don't say I can't do this. Just start again. Yeah.
I say this like probably every day to my patients is small changes matter.
Yeah.
It doesn't have to be all or nothing.
Yeah.
A positive is a positive.
Yeah.
So, yeah.
Yeah. And really lean into celebrating the small changes because it is a journey to get through. For some people, it's easy. For others, like myself, it's taken years because I really, like I said, it really did hit me hard, and I wanted to quit everything. I didn't understand. Like I felt like my body said, we're packing our bags and leaving. You're on your own, and it was like, okay, what do I do? How do I handle this? And so a lot of grace, but leaning into professionals such as yourselves to help get me through that. Leaning into friends and family too. So, yeah, good. Okay, we talked about the brain and what's happening during this time. The hot flashes. Why are the hot flashes so bad? What is happening there?
That's, again, the progesterone and the estrogen balance.
Okay.
Stress plays a huge role in hormones and hot flashes. Sleep, everything we talked about
Yeah.
with the pillars
Yeah.
can help the hot flashes as
Okay.
well. So mindfulness, doing some meditation, breathing,
Yeah.
it helps.
Yeah. One of the things that I learned the last couple years was I was a multitasker. I loved multitasking. The more I had on my plate, the happier I was, the better I worked, the better I performed. I have not been able to do that the last couple years, and I find myself saying no a little bit more, saying, I can't do that. I can't commit to that. I have already, I have to stay focused on the path that I'm on now. That was hard for me. That was really, really hard. And that was something I had to work through and get over. But I have to be honest, I had to fight through the mental process of, am I failing? Am I a failure? Am I, not being supportive enough? But looking back, I'm glad that I learned to get through that journey, to say, no, listen, I would love to do this, but I just can't commit to it, because I needed to focus a lot more on getting myself to a point where maybe I could go back to helping out and being a little more committed to additional things on my plate, which I'm at now. So, yeah.
Do you know what might be interesting? I went into menopause after a hysterectomy years ago.
Okay.
So I didn't really have any of those symptoms.
Okay.
I had hot flashes.
Okay.
But now that I'm my age, I'm dealing more with what you were going through.
Yeah.
So if I would have had to do both at the same time,
Oh, yeah.
it might have sent me into more of a spiral.
Yeah.
So I was like, menopause is nothing. But now I'm here, and it's like, I think it's the whole, I think part of it is age.
Yeah.
Because as we age and our kids or our dogs don't need us as much, or
Yeah.
they're going away,
Yeah.
it makes us feel like, well, who am I?
Yeah.
So I don't even think it's necessarily just menopause. It could just be a whole life, like where we are in life,
Yeah.
and not just hormones.
Yeah. No, that's a great point, and I'm glad that you brought that up, because, a lot of people are not only just dealing with this at this time in their life, they're also dealing with the fact that they have maybe children that are still at home, or children that are now out, empty nesters that have now left. And that's a whole change in our life too. Or you have aging parents that you have to be more careful, be more involved with and taking care of. So now on top of trying to figure out why this change is happening and how to get yourself adjusted, you still have layers of things that you have to do and that you can't just step away from. So, talk from a caregiving point. So if you have someone who's also going through this, but they're also a caregiver, or there's a bigger life change on top of this, what are some things that you would talk through with them?
I think there's a lot of guilt when you're a caregiver, especially if you're dealing with your parents.
Okay.
Because you're trying really hard to do the best thing. But sometimes parents can be difficult. It's just, and if you're sandwiched between kids and ill parents, it's really hard. So you have to give yourself grace.
Yeah.
Ask for help. Talk to someone. It's not a fun place to be, and you deserve support.
Yeah. Yeah, I have a friend who is living with her mom, is a caregiver for her mom, who's elderly but also dealing with cancer. And she reached out to a family member, and that family member is able to give her a couple hours of break each week so that she can at least step away and just kind of, do her thing and get that break. So that's a really key point there, is make sure that you're asking for help, no matter what you're going through. So
It's the pillars. It's
Yep.
the 6 pillars.
I know, but we, why do we hate to ask for help? We feel like we can take it all on, and
Yeah.
but that's not where, we're all in this together, so to speak, and that's what, and people want to help. They really do. They really do want to help. So lean into that, friends and family, and just say, I can't do this on my own.
Yeah.
So, and that's nothing to be ashamed of.
Exactly.
Yeah.
Absolutely.
We talked through strategies for anxiety, stress, and mood, and how to manage them. So looking at this pause in our lives through a different lens, sorry, I just had a brain thing.
It's the menopause.
Thanks, Kirsten.
It's the pause.
It is. Well, okay, let's just go into that since we're talking about it. But I call it squirreling. We can be having a conversation, and all of a sudden it's like, where was I going with that? Where did I put that? What was happening there? So I find myself doing that a lot. Is a squirrel, but looking at this pause in my life differently, and really focusing into, at first when this started happening, I was hit with a lot of anxiety and fear because I thought, where am I going? What's happening here? Do I have to completely start over? And now that I'm a couple years into it, I'm starting, as I'm working through the lifestyle changes and working through, kind of reinventing myself. I'm actually excited,
Yeah.
I'm excited for the next chapter. So, yeah. You had mentioned about having more self-love and self-care.
I think we both did.
Yeah. Well, you both did, yeah. So talk through the self-love piece of that.
I think what you said before, and you mentioned too, like the guilt.
Yeah.
And I know just like with me being a mom, you want to be a perfect mom, and then you have your work obligations, and then you're supposed to look a certain way, and it's just like a ton of pressure all the time.
Yeah.
But you just have to you have to be more realistic about it. And I'm always telling people too, like, talk to yourself like you're your best friend. Like, what if
Yeah.
your best friend came to you and said, like, oh, I can't do anything right, I'm not a good mom, I'm not doing enough at work, I'm not keeping up with my appearance, what would you say to them? You wouldn't be like, yeah, like, I've been meaning to talk to you about that. You would point out,
your friends are.
like, look at all the things you have on your plate,
Yeah.
and you're doing great, and giving yourself grace, like Missy had mentioned. Staying off social media too much because there's those picture perfect people all the time, and people using filters and cosmetic procedures to just look a certain way, and that's not reality.
Yeah.
But
Yeah, and it's not reality, but it's also not your story.
yeah,
It's somebody else's story. So stop looking at how everybody else is doing it, because you've got your own story playing out, and people want to see your story come to life and see that happen. So yeah, that's a great thing. Talk about relationships, and we talked a little, Kirsten, about social connection, but talk a little bit more about relationships in this time, in this change, because when I was dealing with a lot of anxiety and fear, I kind of felt myself pulling away, where I wasn't reaching out. One, because I just felt like I honestly, I felt like maybe nobody really understands what I'm going through, but that's not the case.
I think sometimes you do need some extra space when you're going through some changes.
Yeah.
So having some time to yourself and doing some meditating or breathing and figuring out who you are and what you want moving forward.
Yeah.
And maybe actually sitting down and writing goals as to what you want to do. And then finding those people who bring you joy and love and acceptance.
Yeah.
And leaning into them when you're having a hard time.
Yeah.
I have to tell you, Tasha and Kirsten and I, we work really well together.
Yeah.
It's a very supportive environment.
Yeah.
So we might not all be perimenopause or menopausal, but it's good.
Yeah.
Yeah, and it's nice. I mean, it's nice to have Missy, and she mentioned that being a role model is something you talk about a lot. Kind of, you're sitting here going over those 6 pillars, and that's something you really practice.
Yeah.
So just as me, being a little younger than you, not too much, but I can
could be your
look
mom.
to you as a good role model
Yeah.
of like, when I'm experiencing those changes, like look how Missy's thriving,
Yeah. Yeah, age is just a number, and we all have something that we can offer to the generation that is coming ahead of us, and we have so much we can learn from the generation that's behind us. And so that's really what I try to embrace is, I love interacting with the younger employees that we have on staff. They have so much energy. I'm a little jealous of that, but just love their interaction. I love learning and watching what they are doing that I didn't do at that age. Yeah. And hoping that I can also now take some of the things that I learned from my grandmother, from my great-grandmother, my mom, and pass that along to the next generation. As I recently was with my niece, she's got 2 little girls, and just talking about the history of our family, but talking about I learned how to sew from my mom. I learned how to can goods. So knowing that and knowing I can pass that along is so good. So still so much that we can help each other with and support no matter what age. And age is just a number. It's really how you feel. So I would say one of the really great things that somebody said to me during this time that stuck with me and was extremely helpful was, when we're young, we're really just trying to kind of get our feet set on the path that we're on. And depending what that looks like, if you have a family and you have children, you might just be trying to get a job where you have money, where you have the money coming in so you can pay bills and you can support your family, or going to college or that type of thing. And maybe there was a dream that you had, but it just didn't fit in at that time. And this is a great opportunity in your life to look back and say, I always wanted to do this, or I always wanted to do that. And now's my chance to do that, because maybe you don't need to like keep going down that path just to pay bills. And, you know, the kids are out of the house or grown up, or, you know, you don't have, you know, the life things that you had in the last couple years. But you have a chance to think about like, hey, you know, at one time I had a dream to do, you know, to own a boat and you know, go around the world in a boat and go fishing or you know, whatever, or climb Mount Everest. And you can still do that. Mm-hmm. Yeah. So it's a great time to just, like it says, to pause, catch your breath, and then get ready for the next exciting chapter. So
Maybe dream a little bit.
dream a lot. Yeah. Dream a lot. Yeah. Good. Well, Missy and Kirsten, thank you so much for taking the time to provide your experience, your medical background. Like I said, I feel like this is just the top layer of this subject, so maybe we can get some feedback from the audience and dive a little bit deeper into this with the subject, because it is a pretty intense subject. But if you're experiencing life's transitions, navigating this chapter in your story means embracing evolution rather than resisting it. It may involve shifting career paths, deepening relationships, or prioritizing your well-being. It's about stepping forward with confidence, recognizing that age doesn't impose limits, it refines purpose. This stage in your story isn't a final act, but rather an intermission, a pause to reflect, recalibrate, and prepare for an inspiring next chapter. Every great story unfolds with a thrilling second act, filled with discovery, transformation, and possibility. What new adventures are calling you? Thank you.